Doctor, President-elect Biden is taking office at the absolute worst point in this pandemic. Give us an assessment of where we are at this moment in terms of controlling the spread and rolling out vaccinations.
Stephanie, unfortunately, we are at a very critical point in this pandemic where cases continue to rise. We still haven't seen the full brunt of the surge that will follow the Christmas and New Year's holidays. And already hospitals, ICUs are full. Healthcare workers are burned out. They didn't get to take the same holiday everybody else did. I think, unfortunately, we're going to be seeing a situation of rationing, of trying to make difficult decisions about who gets what care across the country as the surge continues.
The UK began administering the Oxford AstraZeneca vaccine this morning. This one is cheaper. It's easier to store. If we approve it, could that help solve our vaccination rollout issue?
Well, it certainly would help, but given where we are in terms of gathering data on safety and efficacy, the FDA in this country is the gold standard in terms of how we assess data on safety and efficacy. We're looking at probably not getting an approval of the AstraZeneca vaccine in this country, or I should say an emergency use authorization, until April. And so there's a lot that needs to be done between now and then. And unfortunately, the current administration, the federal government, has really abdicated its leadership on this. This is not just about playing UPS or FedEx and dropping off doses of vaccine at the door of states. This really requires a massive planning effort and funding to back that.
Is that planning effort happening for when President-elect Biden takes office? We know that the most recent stimulus plan has gone through. Is this going to get solved in 20 days?
Unfortunately, I don't think this is going to be solved in 20 days. Some of these things have not happened over the past year that should have been happening. This initial phase of vaccination with healthcare workers and long-term care facilities like nursing homes, that's the easy part. Those are people who are very easy to locate. They're in the facility where the vaccination's happening. You just go from employee to employee or patient to patient, resident to resident in the nursing home. But once you start to get into phase 1B, 1C, and so on of the vaccination rollout, that's where it gets a lot more complicated. I've been getting emails from people saying, well, why can't I volunteer? I'm a nurse or I'm a dentist or I'm a veterinarian and I'd like to be a vaccinator. I'll give you just one example of the kind of thing that should have been happening over the last year. The federal government should have been working with states to make it possible for people from other health professions to volunteer and help or to get paid to help. And that means changing what we call scope of work regulations. Right now, people in very specific healthcare jobs can only do certain tasks. That needs to be liberalized in the context of a public health emergency. And then you have state licensing requirements. You don't have one national license to be a nurse or a doctor. You have to have a license in each and every state. So me in New York City, if I want to go over the state border to help out in Newark, New Jersey, I can't with my New York State license. So these are not partisan issues. These are just bureaucratic obstacles that should have been fixed over the past year.
Well, now we can fix them. Can you just fact check this for us? Over the weekend, President Trump tweeted that the CDC is far exaggerating the U.S. COVID death toll, saying it was fake news. Dr. Anthony Fauci already directly refuted that, and I can't seem to understand why on earth the CDC would exaggerate it. So can you fact check this?
This is unfortunately more falsehood from the president, who has downplayed this pandemic the entire past year, who said it would magically disappear. The way the CDC looks at the numbers, they look at every different contributing factor to somebody's death. So if you develop kidney failure because you had coronavirus infection, they will list both in terms of your illnesses. If, for example, you have a heart attack and you had diabetes and high blood pressure as contributors to that, they will list all three. That is a scientifically accurate way of reporting the data. It's just not convenient to the president.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.